Hello, everyone. Today, we're going to take an in-depth look at the silent accomplices that fuel atherosclerosis, and then present comprehensive prevention and treatment strategies. Atherosclerosis is the process by which plaques composed of low-density lipoprotein L, cholesterol, inflammatory cells, and calcium build up on the inner walls of arteries, causing the vessel lumen to narrow, the vessel wall to lose elasticity, and become prone to rupture. When a plaque ruptures, a blood clot forms immediately and can completely block blood flow to the heart, brain, or limbs, leading to myocardial infarction, heart attack, stroke, or limb necrosis. 1. Daily habits that fuel atherosclerosis. 1. High-saturated fat and refined sugar diet. Fast food, fried snacks, sodas, and sweets are all loaded with saturated fats and refined sugars. This diet raises blood levels of LDL and triglycerides and creates small, dense LDL particles that readily penetrate the vessel wall and become oxidized, kickstarting plaque formation. 2. Physical inactivity and prolonged sitting. Sitting for long periods reduces the activity of lipoprotein lipase, LPL, the enzyme that breaks down triglycerides and LDL in the blood. When LPL activity drops, triglycerides and LDL accumulate, increasing the risk of peripheral plaque. Poor leg circulation further increases peripheral artery disease risk. 3. Smoking and secondhand smoke. Nicotine and carbon monoxide in tobacco smoke damage the endothelium, increase oxidative stress and chronic inflammation, and reduce HDL, good cholesterol, accelerating LDL deposition and plaque growth. 4. Chronic high blood pressure. Sustained elevated blood pressure injures the endothelium, creating entry points for LDL and promoting plaque buildup. As the lumen narrows, blood pressure rises further, a vicious cycle that is difficult to break. 5. Uncontrolled diabetes. High blood sugar leads to non-enzymatic glycation of vessel wall proteins, forming advanced glycation end products, AGEs, that trigger inflammation and stiffen arteries. AGEs also make LDL more prone to oxidation, speeding plaque progression. 6. Chronic stress and sleep deprivation. Ongoing stress activates the hypothalamic pituitary adrenal (HPA) axis, raising cortisol and adrenaline. Elevated cortisol promotes insulin resistance, increases blood sugar and blood pressure, and fuels chronic inflammation, accelerating atherosclerosis. Less than 6 hours of sleep per night further raises C-reactive protein, CRP, a marker of inflammation, and ramps up sympathetic activity. 7. Excessive alcohol consumption. Alcohol breakdown in the liver produces acetaldehyde, which damages liver and endothelial cells. Alcohol also boosts triglyceride and VLDL production, worsening dyslipidemia, and often increases cravings for high-sugar, high-fat foods. 8. Genetics and age. A family history of early cardiovascular events, men 55 years, women 65 years, or inherited lipid disorders greatly increases risk. Aging also impairs endothelial repair and LDL clearance, allowing plaques to accumulate more easily. 2. Serious consequences if left untreated. 1. Acute myocardial infarction. Plaque rupture in a coronary artery triggers rapid clot formation that can fully block blood flow. Without oxygen, heart muscle begins to die within 20 to 40 minutes, causing severe chest pain, sweating, nausea, and a high risk of sudden death if not treated immediately. 2. Ischemic stroke. A clot in a cerebral artery, or an embolus lodging in the brain, cuts off oxygen supply, causing brain cells to die within minutes. The result can be paralysis of one side, speech impairment, or death. 3. Peripheral artery disease. Chronic ischemia in the legs leads to pain with walking, non-healing ulcers, and gangrene, often necessitating amputation if untreated. 4. Chronic kidney disease. Atherosclerosis in the renal arteries reduces glomerular filtration, leading to progressive kidney failure and eventual need for dialysis. 5. Aneurysm formation and rupture. Loss of arterial elasticity can cause localized dilation, aneurysm, especially in the abdominal aorta or cerebral vessels. A ruptured aneurysm results in massive hemorrhage and is often rapidly fatal. 3. Comprehensive prevention and treatment. 1. Lifestyle modification. Nutrition. Choose unsaturated fats, olive oil, fatty fish. Increase vegetables, fruits, and whole grains. Limit refined sugars and processed foods. Exercise. Aim for at least 150 minutes a week of moderate activity, brisk walking, swimming, cycling, plus light resistance training to build muscle and boost metabolism. Smoking cessation. Quit completely and avoid secondhand smoke. Stress management, sleep. Practice meditation, yoga, or breathing exercises. Ensure 7 to 8 hours of quality sleep per night. 2. Regular screening and testing. Lipid panel. Target LDL 100 mg per deciliter or 70 mg per deciliter for high risk, HDL 40 mg per deciliter men or 50 mg per deciliter women, triglycerides 150 mg per deciliter. Blood pressure, maintain 130/80 mmHg. Blood glucose, aim for HbA1c 7% in diabetics. Vascular imaging, Doppler ultrasound of peripheral arteries and coronary CT as indicated. 3. Medical therapy, statins, lower cholesterol synthesis and stabilize plaques. Antihypertensives, ACE inhibitors, ARBs, beta blockers, calcium channel blockers. Antiplatelet agents, low-dose aspirin or clopidogrel. Glucose-lowering drugs, metformin, sulfonylureas, insulin, or newer agents tailored to individual needs. 4. Interventional and surgical procedures, percutaneous coronary intervention, PCI, balloon angioplasty and stent placement to open narrowed coronary arteries. Coronary artery bypass grafting, CABG, surgical bypass of severely blocked vessels when multiple arteries are affected. Atherosclerosis is a silent yet formidable adversary, but by recognizing and correcting harmful habits, undergoing regular screenings, and following evidence-based medical therapies, you can prevent its progression and avoid devastating complications. Start today to protect your heart and health.